And that was Bert Momolo reporting. Okay, we're going to talk about something now that you certainly may take for granted even after it's gone. We're talking about your hearing. Do you think you hear well? Well, it turns out, don't be surprised if it's not the case, and you may not have even noticed it started to go downhill. We've got Dr. Marc Eisen with us right now. He's got details on a new study that just came out. Dr. Eisen is an ear surgeon at Hartford Hospital and with the Connecticut Ear, Nose, and Throat Associates. And a pleasure to meet you, Doctor. Thank you. All right, well, this new study, as we were talking about, it just came out from the Centers of Disease Control recently. What did it find?
Well, the study itself is not too much of a surprise, but what it does is it brings to light that hearing loss is very prevalent, but it's more prevalent in younger people, and it's more prevalent in people that are exposed to noise outside of the workplace. In the past, workplace is very well regulated as far as noise and the danger of noise, but now environmental noises, and we're listening to our iPods, and we have our headphones in, and it turns out it's creating some more hearing loss than we thought before.
And it's something that I thought was interesting is the proportion of people who did not realize that they were suffering.
Yeah,
from
that's
hearing
important because hearing loss is insidious, meaning it can come on slowly and can progress, and you don't really notice it because you're only one person. You don't have much to compare it to, and the way to find out if you have hearing loss really requires a hearing test, which is an objective way of looking at what you're hearing. Because again, you don't always know if you have the loss.
Okay, so why aren't more people getting hearing tests, or when should that happen?
I think you tend not to notice it or recognize it, and the only way to know is to literally to get a hearing test. And now there's some exceptions to that. There's sometimes you have fullness in one ear, and that can be an alarming situation that you really have to bring that to medical attention. Yeah. And those are some things that can be problems, and it's not always you don't want to just laugh it off. It's important to pursue it.
Also, ringing in the ears. Do you remember there's an old public service announcement with Tony Randall back in the day where he goes, tinnitus, 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 tinnitus.
Yeah, potato.
Yeah, you can't figure out how to say it.
We call it tinnitus, and tinnitus, I think either way we know what we're talking about, which is sounds that we hear in our head that are not coming from the outside world. And being human, you'll probably have tinnitus, but sometimes it's worse, sometimes it's more bothersome. And it can be the sign of hearing loss. It isn't always, but it's the sign that you should get a hearing test. Okay, so assuming some people out there go to get a hearing test, they find out that they're not hearing as well as they should be. What is the next step? A medical workup is important because there are some medical reasons that hearing loss can show itself. Those have to be ruled out. And there's some common age-related hearing loss is very common. It's not really medical, but once you're you've ruled out the medical things, it depends on how much the hearing loss is bothering you in your lifestyle. You might have more trouble, the same hearing as someone else who has the same hearing but has more trouble, and the choice of hearing aids is really one that's very personal.
When is a normal age? I know it's probably hard a normal age for age-related hearing loss.
Yeah, age-related hearing loss probably starts in your 50s, but you don't really notice it or recognize it on a test till about 70s. Okay. And that's typical, very highly variable. Yeah. Take all comers about age 70 is probably when it starts to show itself.
Short of a hearing aid, what do you do to help people who are starting to suffer from hearing loss?
Yeah, so for the non-medical, more age-related hearing loss or even noise-induced hearing loss, hearing aids are really the answer. If it gets severe enough, there's the implants that we start thinking about.
Cochlear ones?
Those are the cochlear implant, exactly. And that's really reserved for the people who cannot wear hearing aids because their hearing loss has progressed so great.
Is it reversible in any way, shape, or form?
Sometimes yes, and most of the time no. That's what the CDC wants everyone to know, which is try not to lose it because once it's gone, it doesn't come back.
I'm guessing most people don't have sort of an inherent idea of what decibel level corresponds to what sound. So is there a really rough guide you can quickly give people to say this kind of level of sound you need to avoid for a certain amount of time?
Sure. If it's uncomfortable, chances are you probably shouldn't be in it for too long.
Okay.
And that's a good kind of general test.
That's probably not the best sign for concerts.
Not ideal. And if you have ringing after you have exposure to loud sound, that can be the sign of a little bit of damage.
There you go. Okay, well, bottom line here, if you think you might have a problem, go get a hearing test. And even if you don't think you have a problem, go get a hearing test at some point. Doctor, thank you so much for the knowledge right now. Now I'm going to go get myself checked. But